Welcome to our eLotus webinar. My name is Donna, and I will be your host and your moderator for today's class. Here at Lotus Institute of Integrative Medicine, we have been holding educational seminars and webinars for over a decade. And it's been such a wonderful journey filled with many experiences and lessons taught by speakers who are not only experts in their respective fields, but most importantly, they're willing to share their wealth of knowledge with all of us. We believe that the future of TCM contributes to, hi, welcome. We believe that the future of TCM can only be continued through growth and progress, and that's what we do here at eLotus. Okay, so let's get started with today's class. I'm going to give an introduction. Jack Schaefer is a graduate of Oregon College of Oriental Medicine and completed his postgraduate study at the Nanjing University of Traditional Chinese Medicine in Nanjing, China. To continue development and education, he makes regular trips to China both to consult on difficult cases and to further his knowledge and experience in Chinese medicine. As a professor at Southwest Acupuncture College in Boulder, he has taught a variety of topics, including the use of secondary channels in the treatment of diseases. He has also been published in the Lantern and the Journal of Chinese Medicine. Using this multi-layer of acupuncture in his Boulder, Colorado private practice, Jack has worked extensively with pain syndromes, athletes, and internal medicine. Okay, so today's class is Painful Beast Syndromes, Effective Protocols, using multi-layer meridian model. Let's go ahead and welcome Jack.
Hey everybody, welcome. Thanks for coming today. And before we get started, do I actually get to see the chat box on here, or do I only see my screens? Okay, great. So Donna gave me a really great introduction, and it's definitely more than generous about who I am and what I do. You know, I started studying Chinese medicine back in the 90s, and like she said, graduated from OCOM. I've done a fair amount of study in addition to that, just trying to figure out these different aspects of Chinese medicine. And one thing I've noticed as a teacher and a clinic supervisor, as well as having interns and employees in my own clinic, is that there are definitely some holes in people's acupuncture game. You know, there's some holes in their ability to get results. And I think, you know, if you look at how most people are treating everything, they're almost always just trying to use the primary channels. So, you know, they're using the stomach channel, the heart channel, or whatever, just using those as their main treatment modalities. And I think for a lot of things that's great. But you know, for those of you who are herbalists, you would never give everybody formulas out of the same herbal category to treat a problem. You know, you wouldn't just treat everything with Guizhotong. You know, it's just, there are people out there who pull that kind of thing off, but when you dissect their formulas, they're usually mixing in a whole bunch of other things, and there's this homage to Guizhotong, or there's this homage to whatever thing they're doing. But in the end, you know, you need more tools in your toolbox. And so if we're just using a screwdriver to fix everything on our car, we're not going to get very far. And that thinking about that really drew me into, okay, well, we have all these other things that we learn while we're in school. You know, these other channel systems, the divergent channels and the extra vessels and the sinew channels and the luomai, and but how do we use them? And sometimes, you know, I know some schools people learn a little bit about it, and some schools people don't. Some people will have teachers that do it, and some don't. And so I decided what I'd like to do is really explore this topic, and this became a kind of a passion for me for about, you know, almost 15 years of trying to just figure these channels out and figure out how we could use them. So I started thinking about acupuncture as a formula, you know, rather than just always trying to use one herb, i.e. using one channel layer like the primary channels. What about how do we use a sinew channel? How do we think about that, and when is it appropriate? Or how do we use a luomai, and when is that appropriate? Or how do we use an extra vessel or a divergent channel rather than just using them as sort of last hope things? And I think one place we can illustrate this is there's a lady in my office that we recently saw who she had knee surgery, and she was coming in, just for kind of post-surgery symptoms and pain and whatnot. And when you look at her diagnosis, you see her, this is who I'm talking about up in here. She's got, a little bit of blood stasis left over from the surgery. She's got a little bit of swelling, which is dampness. And she has some chi stagnation, and pain. And then she's got this cold in all three yang channels. And so rather than just using the primary channels to treat her, what we did was we tried to address these different aspects of this diagnosis with the different channel systems. So for me, this blood stasis and damp and the chi stagnation and the cold, we could try and figure out where they're actually at. Are they in the primary vessels, or are they in the sinew channels or whatnot? And so her treatment ended up being kind of a layer of lower vessels and sinew channel and primary channel, and very effective that way. And it looked much like her herbal formula actually looked like that too. And so I think one of the things I want to do, before we get too far, this layering idea of channels, this way of mixing the channels together and thinking about them, you can do this for internal disharmonies too, to some degree. I think B syndromes are the easiest place to see this, because the most superficial layers, the superficial loma and the sinew channel, those guys are really much more B oriented, but we can think about the primary channels, the divergent channels, and the 8 extra vessels in this layering aspect too, and think about that in terms of internal disharmonies. So, but our lecture here today is really on B syndromes, and it's an easy way to get to know this concept. And then I think you'll be able to, on your own, start to put it together a little bit. So I want to clarify B syndromes before we go any further, though. And I know you guys, who've studied Chinese medicine, some of you guys for years and years, some of you guys probably longer than I have, know what B syndromes are, but I want to make sure that we're all on the same page so that we're clear. If we look at what a B syndrome is, right? B syndromes, it just really means impediment. It just means that there's some sort of stagnation or problem in it. They tend to be in the muscles, then the bones and the joints. They can be in the skin. Their Western diagnosis is like rheumatoid arthritis or osteoarthritis, gout, sciatica, bursitis, carpal tunnel, tendinitis, overuse injuries, traumatic injuries. All those things can fall under the purview of B syndrome. And so, when we're at school, we usually learn all these random B, bony B and cold B and wind B. In the end, they just mean there's some sort of impediment somewhere or by something. And so, in the diagnosis with Chinese medicine, we see that B syndromes are usually, they're either some external attack, like some external pathogen breaks its way into the body, either one of the evil chi, cold, damp, wind, heat, that kind of stuff. We don't typically see dryness cause a B syndrome. Theoretically, it's possible, it's just not common. Or we'll see like a traumatic injury cause it. If you go out and you fall down and blow out your knee or whatever, or your elbow, that'll be a B impediment syndrome. It'll be a traumatic B. Or you can have this overuse injury where you guys have seen this probably, people who like work on a computer all day and they start to get what looks like tennis elbow. It's just from typing. That's an overuse impediment, So we have to decide, what is the cause of this B? And those 6 external evil chi, they're basically what allows that to happen is the same, thank you, as when we get sick. If you're going to catch a cold, it either means that the internal, your zheng qi is weaker than the pathogens that are attacking at you. So you're either a deficient person, a weak person, and the external pathogens aren't that strong, or you're a normal person and the pathogens are unseasonably strong or exceedingly strong. And so somehow that cold, that wind, that damp, whatever it is, penetrates the body. That's how we catch external pathogen invasions that cause colds and flus, but it's also how people get these little B syndromes. So let's be clear on that. Then when we start diagnosing our B impediments, we need to diagnose what's causing the stagnation. And I think one of the biggest mistakes I see as a supervisor in a college is students just want to call everything chi and blood stagnation. And chi and blood stagnation, while there may be chi and or chi and blood stagnation in a problem, rarely is it that there's chi and blood stagnation exhibiting by itself. You know, there's almost always something that causes it, if that makes sense to you guys. We have to have something that stagnates it, and if we don't deal with the something, then we miss the problem. You know, we just move the blood and people feel better, you know. But I think about it like this, like, you know, you guys have all had headache patients before. Nobody has ever had a headache from an aspirin deficiency, you know. You just don't get headaches from that. Aspirin is a way of treating the pain, right? It makes you feel better, but it doesn't actually fix it usually. There has to be something that causes the headache, and that's what we have to look for. And so in the case of bee impediments, a lot of times it's just going to be that, you know, cold or wind or damp or overuse or something, but we have to figure that out, and if we can, we need to treat that as well. So that all leads into this kind of looking at the classics. And this is a statement I like a lot. It's out of the Huangdi Neijing Ling Shu, chapter 10. And he basically says the major channels are able to decide life and death. They are the dwellings of the 100 diseases, but also the harmonizers of hollowness and solidity. And this cannot be done if they cannot be understood. Meaning you can't harmonize hollowness and solidity. You can't fix things. So, you know, as far back as the Neijing, they're saying, look, you need to understand the channel systems. They're important for us. Now, as a clinician, for me, I think, you know, while it's really, really important for us to look back at the classical literature and understand the classical literature, we're also modern people in a modern world using different kinds of needles, and treatment for us is different back then, and we need to apply that modern understanding of the body to the theory and the understanding of the traditional medicine. And so an idea of that, for example, is I'm a big proponent of using motor points in sinew channel treatments rather than just Osher needling. Just going for just needling trigger points. I like to use because I find the motor points to be a little bit more effective in that way. So is an example of mixing old with new. So what we need to do is we need to kind of reacquaint ourselves with the channel systems, with these layers of the channels. And when it you know, comes to each one of them, the lower vessels, the sinew channels, the primary channels, they all have their own physical morphology. You know, they're different from each other. They're not exactly the same. They all have their own pathology. So they reflect diseases in their own specific way. And they also have their own, you know, specific way of being treated. And so I think later on in the webinar we'll do some cases. I'll give you some case examples of how this works. And if you saw the one I did on Tuesday, the Tuesday before, the intro to this webinar, I talked about a couple of cases where we were treating one particular layer and it wasn't working, and we had to switch layers, and that actually is what made it work. And so you see that they each have a different way of being addressed. And this isn't, I'm not going to give you an exhaustive way, but I'm going to give you what clinically is pretty effective for me. I have a really busy clinic. We see lots and lots of patients, and we found, you know, I tend to only keep things that work. While I would like to keep things that I like to keep things that work. So let's kind of take a look at the channel anatomy for a minute before we get too much further into this. And I think this will help you understand kind of where we're coming from. So the three-dimensional channel anatomy as seen by most acupuncturists, and they varies a little bit depending on who you read, is that we kind of go from shallow to deep. And so from shallow to deep, we start at the skin, right? And at the skin, we have these minute lower collaterals, these minute little tiny blood vessels and collaterals. And from there, slightly deep to that. So by the way, in that lower collateral, when you look in the textbooks and they talk about the cutaneous regions, that's what you see. are those minute lower collaterals. They're what comes up in the skin, in the cutaneous regions. And so if somebody's talking about the bladder channel cutaneous region, that whole big area, that's the bladder channel cutaneous region. Okay? So that anything you see in that entire region attributes to those, the bladder minute lower collaterals. And then deep to that, you'll find the lower connecting channels and the sinew channels, and the primary channels are deep to that, and the extraordinary vessels. And then deep to that, you'll find the divergent channels and the 8 extra vessels. And so we think of this as an energetic three-dimensional layer. And some people will transpose a couple of these around a little bit. The version that I like to use clinically is this version. And I don't know how well you guys can see this. It's a little bit blurry, but I like to draw it this way. So if we look at it, this first layer, this is the skin, right? And at the skin, this is where we see those minute lower collaterals. And that little minute lower collateral, those little blood vessels, they fill up this entire area, right? And then just below them is where we start to see the lower connecting channel. This is the lower channel. This is the same channel that you learn in school, is like from lung 7 spreads out into the thenar eminence, or from the large intestine one goes up the arm, up towards the head. That's the lower connecting channel. And then deep to that, find another color here. Deep to that we find the sinew channel, right? The musculotendinous channels, the sinew. And then finally deep to that, you find the primary vessel. Right? That's the primary channel. This is like the what we think of as the lung meridian, or the large intestine meridian. And then deep to that is the internal branch of that channel. So the internal branch of the large intestine, or internal branch of the lung, or whatever. And then the next layer in are the divergents. Right? And then the last, sort of the most deep place, of the 8 extras. So we all, I think, if you read Deadman or Wiseman or any of those other books when you were studying in school, you saw some version of this when you were there, and we can usually kind of just study it and then we move on. And I didn't really think a lot about it until I had actually graduated, how this works. But there's this idea of these guys being at different levels in the body, and we need to treat them at that specific level rather than just try and treat everything the same. So what I think really touched me was there was a teacher I worked with in China, and he was a pretty old doctor, and he passed away years ago. But one of his big things he used to constantly say was, you need treat the problem where it's at. He was also a Bagua martial arts guy, and he'd say, bring the fight to them where the fight's at. He's like, you don't, if they're over here, you don't fight over here. It didn't make sense. You've got to be where the problem is. And when it comes to acupuncture, we need to needle the person or treat the person where they're at. So this layering acupuncture idea that we're going to talk about through the rest of this webinar is based on this concept. Okay, so I want to bring in a couple of concepts, or a couple things from the Tsuwen that support this idea. And these concepts really gave me some influence when I was coming up with this strategy. So the Neijing says diseases include those at the surface and others in the depth. Piercing, i.e. needling or bleeding or whatever, includes shallow needling, deep needling. Always go to the respective structures, the skin, the flesh, the vessels, the sinews, the bones. When the proper measure of shallow or deep piercing is not achieved, contrary to what your intention is, this will cause severe injury and excite the 5 zang organs internally. So the way this, I like to use translations that you guys can actually have reference to yourself rather than translate them myself. That way you can read the book. But so what the Neijing is saying is, look, the diseases are in all these different places, and that's where you need to treat them. So if you have a disease in the primary vessels, great, needle the primary vessel. But if the disease is in the skin, at the minute lomi, or if it's in the sinew channel, why would I needle the primary vessel? It doesn't make any sense. But still, I think a lot of us insist on doing it. Okay? But that's contrary to what the Neijing is telling us to do. And so if you treat the primary channel and the disease is in the minute loa vessels, then there's a good chance that you're fighting the fight, you're not taking the fight to where the person is. So they're over here and you're fighting over here. It just doesn't make any sense. Okay? The next idea of this, or next quote I want to bring in from the Suwen, is also talking about how pathogens progress. And basically, I'll read it to you, but it says, when evil chi settles in the physical appearance, it first lodges in the skin and the hair. So it's basically saying, yeah, the first thing a pathogen does is hits the skin, hits the surface, and sits there. Okay? And it stays there for a while, and if it doesn't leave, then it enters more deeper. And this is what he said is the tertiary vessels. And the tertiary vessels, he means these minute loa collaterals. These little, they call the twin lo, the little guys. And if it stays there for a while, and if it doesn't leave, then it enters further into the network vessels, i.e. the loa connecting channel. Okay, so the pathogen now can make its way to the loa connecting channel. And then it stays there for a while, and if it doesn't leave, it'll enter further into the conduit vessels, which link up with the five zong and spreads through the intestines and the stomach and blah, blah, blah. Okay, so how do we interpret this as a clinician? What we can interpret this as, the pathogen hits the body, cold, wind, damp, whatever, and it's on the surface. Given what we talked about with how bee impediments get in, they're either a pathogen that's relatively stronger than the person's zheng qi, or the person's zheng qi is weak. Either way, that pathogen gets in. So cold, wind, damp, passes the skin. The first place we're going to look is these minute loa collaterals. And then the next place it's going to reach is the loa vessel. And if the person's body still can't kick it out, or we as a clinician still can't help them get it out, then it's going to get its way into the sinew channel. And if they still don't get it out, then it's going to get its way into the primary vessels. If it gets into the primary channels, this is where, as a patient, we're in trouble, right? Because now that cold or whatever pathogen has access to the rest of the body, right? So it's no longer stuck in just the exterior. It's in the meridian system, and if it's in that meridian system, it's got a door to get into the organs. And that's why at the last part of the quote he says, it links up with the 5 depots internally and spreads to the intestines and da-da-da-da. And basically just means this person now can get sick from it. So how long does that take for this to happen? It can happen really quickly. I mean, you can wake up in the morning with, a backache, cold invasion in the backache. It doesn't necessarily mean that, and it could be in the sinew channel, so it can get past those superficial layers pretty quickly. Think of how many times you've probably seen a patient in your clinic who has acute torticollis, right? They come walking into your clinic with an acute stiff neck. That, by and large, is a sinew channel disorder, So that cold penetrated past the skin, past the minute loa, maybe past the loa connecting channel, and into the sinew channel pretty quickly. So it doesn't necessarily mean this is going to take days or weeks to happen. And sometimes it'll start to go backwards. Now this description that the Neijing is talking about is when a pathogen comes in. I've also found this to go the other way, reflective to a traumatic injury. So in that, the case we were talking about in the introduction, the woman with the knee surgery, she also, you know, before she came in for her first visit post-surgery, it had been a couple of weeks. And one thing that happened was her knee, she said, went from looking normal, just being kind of swollen, but the skin was normal looking, to having all these little tiny spider vessels showing up later. And all those little stagnant, spider veins that showed up in her skin were reflective of the blood stasis, maybe at the sinew channel level, beginning to show outwardly. So sometimes with old stagnation or old injuries or injuries that aren't healing very well, you'll see that stuff start to show up backwards. So this quote here is talking about pathogens entering, but with traumatic injuries, sometimes we'll see symptoms going the other way. So if that makes sense to you. If that doesn't make sense to you, please feel free to ask a question. For you guys who are live or for the people online, I think I have access to this chat box. Oh, there we go. Now it's moving. All right. So therefore, the Neijing Suwen and the Lingshu are telling us to follow a pathogen to the correct depth in the body, and to achieve the best results, we need to treat it where it's at. And potentially we can make things worse. And I think that's where you guys, when you were in school, you heard the lore of, don't treat somebody when they're sick, or be careful which points you use when somebody has a cold, or don't needle this point, or all that kind of stuff. Don't tonify. It has more. I think it has more to do with where we're actually doing it. What we're trying to accomplish. I think the theory would be, if this great pointer stick thing were a needle, and somebody had say a cold invasion superficially, and I needle a primary channel point, and I bring that needle all the way down into the primary channel, then I'm creating this conduit. Maybe this door was closed from here down, and I'm all of a sudden making this little conduit and pushing that opportunity down into the primary channel. So now I'm allowing that cold to penetrate deeper. So I think it's just inappropriate treatment. It'd be like giving somebody the wrong, a formula that's inappropriate. It doesn't necessarily mean you can't tonify somebody when they're sick or whatnot, but maybe inappropriately. Okay? This idea you can see in this piece from the Nanjing, and this is really the last really chunk of classical literature I'm going to bring up. This had a big influence on how my needle technique works. And this quote basically says, it's trying to emphasize the importance of protecting the yin qi or the wei qi in how we do our needling. So what it's saying is that when we needle the yang, mean needling the wei level, we need to stay at the wei level. Okay? And when needling the yin, which is on the next slide, we need to actually disperse the wei and needle all the way down to the yin. And you guys can read this yourself, but what this really boils down to is this. The Nanjing is describing us as having kind of roughly 2 layers in the channel system. We've got this layer where the yin qi is, and that yin qi, that's the primary channel qi. And then this more superficial layer, which it's calling the wei qi, right? The wei layer. And this wei would be like those superficial, minute lower collaterals, all the way down to the sinew channels. I think most people, when they're in school, they learn that the wei qi is really kind of carried at the level of the sinew channel, this protective idea. And so what the Nanjing is saying is that, look, if I want to needle this layer, I need to stay in this layer and protect the yin from that layer. Okay, so I'm going to use a needle technique that stays up here. Maybe the Nanjing is recommending a lying needle, like he calls it, a transverse angled needle. So it's saying, look, stay up here, don't go down there. All right? And then it's saying, look, if you want to go down there, if you want to needle that level, then what we do is we disperse this chi. So it describes it as using your left hand, using your pressing hand to squish all this chi out of the way. So when we go to needle something, we rub on it and push that chi out, and then we put the needle in to disperse this so that the needle can get down into this level without taking that chi with it, or without having an effect on that chi, without damaging that chi. Well, we can extrapolate on this a little bit. So when we look at the techniques and the channels through the rest of this workshop, we're going to see that there are some different ways of needling these layers and staying in that layer. Okay? As an aside, this is, for those of you guys who ever wondered about how like tonification and sedation work in acupuncture, it actually, I think, comes from this concept. So everybody's in school, they learn lifting and thrusting as a needle technique, right? So I didn't put the whole quote in here. You can read this in the Nanjing yourselves. Unshold has a really great translation of it with lots of good commentary. But when we're talking about lifting and thrusting to tonify or sedate, what we're really doing is talking about using an exchange of chi from these two layers. So if you wanted to tonify the yin chi layer, right, the primary channel, the way it's described is you take that needle and you're gonna lift and thrust that needle. So you're gonna bring that needle up into the wei chi, and then you're gonna press that wei chi down into the yin chi. So you're adding chi to the yin level. So you raise it up and then you press it down, and you raise it up and you press it down. And that's a way of getting adding chi, adding wei to the yin to create a net increase. The same is true for sedating too. If you wanted to sedate the yin level, then to sedating the yin level, you're basically pulling that chi up into the wei level so it can be dispersed. Because this wei level is open to the outside. Remember we talked, you have all those minute little collaterals and the little connecting channel and the sinew channel all in here. So that's open to the outside. So I can bring that up here, and theoretically it should be dispersed to the outside. That's the idea. There's definitely a physical technique that we're trying to lift and thrust, and there's definitely which way you're trying to put your force. And so a real great teacher I had in Beijing, pretty briefly, he explained which way you're using your effort, which way you're putting your energy into the lift and thrust, whether you're pushing down harder or grabbing and pulling up harder, as which way I'm trying to take this chi. And the idea would be, if there was a pathogen in this primary channel layer, dealing with that would be that sedating technique, right, that brings it up into the wei layer, and maybe even letting the hole open up. And that's why sometimes when you learn those techniques where they're like, pull the needle out and don't cover the hole and let it bleed a little, it's so that whatever you brought up to here can escape, But even if you bring it up to here, it's no longer going to be in the primary channel system, so it's not going to potentially damage the organs anymore. So we had a question on the chat. So are you saying that there is a way to get to the yin chi without touching or affecting the wei chi? Yeah, so like I said, the concept that the Neijing is saying in this chapter is that you're going to squish this all out. You're going to disperse it out of the way. So the way I usually teach this in needle technique is, if you take your arm and you press on it and you blanch the skin and it turns pale for a second, that second or so that it's pale, the wei chi is dispersed. And that's your opportunity, right? That's also one of the ways you make needles not hurt. I think as a teacher, one of the comments I get from students a lot is their fear of freehand needling. Their fear of doing non-tubed needles. And because, if you just go poking at somebody with a sharp thing, it's going to hurt. It doesn't feel good. But if you can find a way to get it through the skin then it doesn't hurt as much. And one of the ways we get it through the skin to make it not hurt as much is we get the wei qi out of the way. Because the wei qi is like the put up your dukes qi. It's the fight back qi, you know? So you just get it out of the way, then it doesn't hurt as much. You know, I think we need to not be afraid of that. You just press on it, disperse that wei qi, and then quickly follow it. Later on, I'll show you the technique that I use clinically that is I think for the most part works really, really well and doesn't produce a lot of pain. That being said, every part of the body is different degrees of sensitivity. So, but it does work pretty well. All right. So so we can see, like, from what the Neijing, the Neijing Lingshu, the Neijing Suwen, and the Nanjing are saying, they really do allude to these different layers of channels, and they're telling us we got to treat these layers. Now, the last place I want to get to is a technical thing, and when we look at the Neijing Lingshu, the Guanzhen chapter, this is a neat chapter to be able to learn some needle technique. And the Guanzhen chapter, what it does is it lists techniques. It lists 9, then it lists another 12, and then it lists another 5, and it describes how they work relatively and kind of how they look, and tells you what they're for. But if you look at it real closely, you'll see that one of the things it does is it's telling you how to treat a layer, how to treat a channel layer. And so when we do the luomai and the sinew channels today, I'm going to pull out a few of these techniques, and because they're pretty easy. You don't have to do them as orthodox as the Lingshu is describing. I think if you can get an understanding of what it's telling you to do, why it's telling you to do this, you can make up your own variations of them to treat your patient population with the needles you use. One thing we have to remember is at the time of the Nanjing, the Neijing, Suwen, and Lingshu, needles were a whole lot different than we have access to now, and I think we can get away with doing some things differently. Okay, so in the end, what we're kind of doing is this 3-dimensional approach to acupuncture. Okay, so we're going to treat starting maybe thinking about them one layer at a time and how we deal with that layer. But in the end, you're going to be able to start to use more than one layer, and this should help you be more on point with your treatments, and also help you keep from letting things sometimes get worse by accident. If we treat the wrong layer, then maybe we're going to potentially get somebody sicker. So we don't want to do that either. Or we're just going to, somebody's going to give up on us. And we've all had that, where we're treating a patient and we're not getting the results we think we should, and they just bail. They're just done. And we know we should have been able to fix it, because it doesn't seem that crazy. It doesn't seem that complicated. Odds are we were just fighting the opponent in the wrong spot. Okay? All right, so let's get into this a little bit meatier. Let me grab a drink of water. So, when we're dealing with B impediments from this meridian layering idea, the majority of the time we're going to stay in the luo vessels, the sinew channels, and then to some degree the primary channels. We're not often going to get into the divergent channels and extra channels. I'm definitely going to talk about them and tell you when is a good time to use them, but they're most of the time, I would say 70–80% of the time, you'll be able to get rid of your B impediments with these more superficial layers. And we'll pull out those other layers when time's appropriate. Okay? So in order to treat a B impediment properly, I keep alluding to this, we need to figure out which layer the problem's in. We need to figure out the nature or type of B impediment it is. So is it cold or damp, or is it blood stasis or whatever? And then we're also going to need to treat as many aspects of that diagnosis as possible. So it's the same way you would do an internal disharmony, right? If somebody came in to see you with spleen tissue causing diarrhea, that's what you would do. So we need to give our B impediments the same kind of respect. So we're going to start out with the law connecting channels. Okay? So I know some of this might be a little bit review, but I like to make sure we get it covered because it helps keep people all on the same page. Okay? So usually, like I like to ask people this: what do you know about law channels? You know, think about for yourself as you're getting ready to start this. What do you know about a law vessel? You know, are we good on time with the tape there? Okay. What do you know about them? You know, we all know the law points. That's something we had to memorize to take our exams. But what do we know about the vessels themselves? And I think the first thing we need to keep in mind is that the Suwon describes them as a place where pathogens first enter the skin. They're the first place that the pathogens enter the body. They get caught in the law vessel. Okay? And so if they can get past your pores, past the surface of the skin, they're going to get into these minute law collaterals. And so that drawing that I did back here on this page, right, they're going to get stuck just real superficially up there. Okay? And then from there, they'll move deeper, right? And they may move from the minute law vessels into the law connecting channel. So think of them as the first place. So, you know, because they're so superficial, one of the things we can think about the minute law is that we can see them, right? So the Ling Shu says that they float to the surface where they can be seen. Okay? That's important for us diagnostically. You know, if we see something on the skin, then we know that there's this problem is in the law vessel, at least partially, because we can see it. Okay? Then the Ling Shu says, you know, the main channels are in the interior. Their horizontal branches are the connecting vessels. And so this horizontal branch idea is also important for us. You know, what most people think about this horizontal branch idea is that, you know, the primary channels do this up and down in the body, like when we look at the little acupuncture figures, you know, they do this up and down in the body. But the law vessels have this ability to take up more space. So while the idea would be, you know, you got somebody's arm, right? This is the elbow, their hand. So this is why I do acupuncture, because I'm not an artist, right? But you know, you've got, you know, we always learn it as like there's the large intestine channel, and this would be like, you know, the Sanjiao channel, and we always learn them as these lines. Well, it's the law vessels, the minute law vessels, and that take up all the space, you know, so they're filling in and bumping up against each other between the two channels. And this happens not only just like between the same channels, these channels in the arm, but it happens horizontally in the body. So if you've ever wondered why you can use like opposite side to treat a problem, it has to do with the law vessel concept. That's where the classical roots of that technique comes from. So there's a chapter called the Myoza chapter, and we'll talk about Myoza as a technique in a little bit. But you know, there's the pathogen crossing horizontally, or the symptom crossing horizontally. Okay, and then these minute law, they fill the space between the skin and the muscles. So you know that refers back to that anatomy chapter, right? The anatomy chapter. This whole area between where your skin is and where the muscle is full of the law collateral. Okay, so that gives us a symptomatic clue right there. If the symptom is in that area, like I can feel it in that area, where the pain is in that area, you can grab a hold of it or touch it, but it's not in the muscle. That's a law, not a primary channel, not a sinew channel. Okay? And this we already talked about. You know, if things make it past the law, they'll make it deeper. Okay? There's another concept that also gets taught a little bit, I think, is is kind of useful. It says the lower connecting channels can't pass through the large joints, right? They're restricted to the space between the skin and the muscles. And so one thing about this is, joint pain typically isn't treated by lower vessel stuff. So if the patient comes into you and they're complaining about like, oh, I've got this, elbow pain, your odds are you're not going to treat that elbow pain, the joint pain, with a lower vessel. Okay? The lower vessels don't reach it. And I think if I remember right, Masayoshi has I think it's Masayoshi. One of the basic textbooks has a really great picture of how the lower vessels don't, they'll fill up a space and then they won't go into the joint and then they fill back up again. So, and then the next thing is, in this same statement, is that they're also really prone to stagnation. Think about how small they are, right? Especially these little tiny guys, they're really prone to stagnation. So, they're easy to stagnate. It doesn't take much cold or damp or wind or blood stasis or whatever to get in there and stagnate them. Okay? So when we talk about the law of vessels, there's really kind of three types. There's the minute law, the twin law, the little grandchild law, the small ones, the tertiary vessels, as Unschuld calls them. There's the law connecting channel that connects the internal to the external paired channels. So the lung 7 to Li4 connection. That's one other law channel. And the third is that the law connecting channel that we learned that kind of runs along the limbs. So like I mentioned, the large intestine goes up the arm, or stomach, or the gallbladder goes down the foot, or like I mentioned, lung 7 goes down into the thenar eminence. We all had to memorize those for our NCCOM exams. It's a good time to bring them back out, because if symptoms are following that pathway, it can also be really useful for us. An example I love to use clinically is Dagger vein syndrome. And every year in our clinic, we get a handful of people who have Dagger veins. And Dagger veins Tenosynovitis is when people have that pain that kind of runs down their wrist, down into their thumb. And it usually starts somewhere around lung 7-ish. And what it is there's the tendon actually runs through kind of like a little pocket, and that gets inflamed and irritated, and then they'll get that traveling sensation. Well, for me, I look at that, I say, well, that pretty much matches the lung-law connecting channel. So because it follows that channel pathway, then it's a good treatment strategy, because it's just following the pathway. So if you can find symptoms that follow the law connecting pathway, then it's also really useful. And if we don't remember them, then we'll never find them. It's like learning pulses, right? You guys are learning pulses. If you can't remember what Dr. Chang calls a roof pulse, if you don't remember what that means, you'll never feel it. You have to memorize what he's talking about, Or if you're doing like Leisure Jen's pulses, what's a soggy pulse? If you can't remember it, you can't find it. So if you don't remember which way the law connecting channels go, you'll never find the symptoms in it. It seems silly, but we always have to keep studying this stuff. I guess that's why they call it practicing medicine, because you're always just trying to remember everything. You learn so much in school, you just got to keep remembering it all. So, and then these last couple things, the law vessels, they nourish an area, they nourish the space between the main channels, right? They keep the tissues full of blood, and in our intro webinar that we did earlier in the week, somebody in there asked a question about could we use this particular thing, I can't exactly remember what it was, for somebody who had a stroke, right? And so they were getting, we were talking about sinew channels. So they were getting weakness in their arm and loss of muscle function, and could we do that? And I think one of the things we want to think about with it is that with this regard to these minute law vessels is bringing that chi and blood in there. if there's a blockage, that qi and blood won't come there. And so downstream from an injury, in that case that we were talking about on that question, it was a stroke, right? So the stroke is creating a roadblock, and then the qi and blood isn't getting into the limb, and then there's this deficiency that results in that. And that's why we use that formula Buyang Huangwutang for that, right? It's a combination of blood movers with a whole bunch of huangqi, right? So it's this moving and tonifying simultaneously. The same thing we would think about is, okay, so they're getting this weakness and this deficiency showing up. Odds are there could be a blockage that's preventing them from getting that nourishment, unless the person is completely weak, right? If their whole body is weak. And then, these other things is balancing yin and yang in the limbs and connecting and harmonizing the left with the right side. That's what I was talking about earlier, this from the Miotsa chapter in the Lingshu, where they're talking about how the body is like covered with a net, basically, of the minute law collaterals. So, so if we let's get into start diagnostics with the Lingshu, okay? And the Lingshu says, it gives you this real specific chapter for diagnosing the law vessels. And for one, it says that, look, when it's red, there's heat or fever, and the area of Li10 or lung 10 can be blue-green if there's cold in the stomach, and red if there's heat in the stomach, and black if there's chronic B. I think, okay, so it's great. It's very specific. It's like lung 10 is blue or whatever. But we can take this concept down and extrapolate it and loosen up a little bit with it. So the idea is really, if you can see it, there's a problem. Simple. Okay? So if you can see red vessels, then we know there's heat, right? If you can see purple or dark colored vessels, then you know there's blood stasis. If you can see light blue, then maybe it's cold. However you diagnose that, it's up to you. You guys all are capable of this. You've all been through school and done all this. You know what all the colors mean. But our point is, if we're looking in area symptoms and we can see the symptom, then they have problems. Allison asked a question. What was that formula? The formula is Bu Yang Huan Wutang. I don't know if you can see that, but Bu Yang Huan Wutang. So, sure, you're welcome. So anyway, the point is, if we can see the minute law vessels, then we're going to have problems. Okay. Now that being said, that's not our only way of diagnosing the law, but it's one. Okay. The next thing I want you to think about with them is if there's something palpable. Now, palpable meaning it's in the skin or just below the skin. So is it in the skin or in that area just below the skin where there's kind of like a little above the muscle. And so sometimes what you'll find there is you'll find like, knotty things, lipomas and whatnot. We're not talking about a muscle knot. We're talking about something that's superficial to the muscle, okay? And so people will find lipomas and cysts and all kinds of things. That technically is a law vessel symptom. Okay, so anytime that you're feeling along somebody's limb, in an area where they've got some kind of symptoms, if you can find, something above the muscle but below the skin, that's a law vessel. The next one is, we're talking about like all those things like that show low heat, vesicles and pustules and all that stuff. There's acne. When you see acne technically is in the law vessels. So cysts, for example, in my clinic we usually treat ganglions. For example, we usually treat those as a law treatment. And we're going to do, I'll use one of the techniques we're going to do here in a little bit is one of the ones we use for this. So, okay. So if we sum this all up with the Lowell vessels, they're the first to be attacked. So they're the first place symptoms will show up, maybe quickly. It might not be one of those things where they're there for a long time, but they're the first ones. They can be anywhere from cold, heat, wind, dampness. You know, all those things can be in the Lowell vessels. If we see pustules, acne-looking things, all that's Lowell vessel. Veins, minute, you know, those little spider veins, those are all Lowell vessel. Or color to the skin, right? So if somebody tweaks their elbow and the skin is red, part of that problem is in the Lowell vessels. It may not be the only place, but part of it's in the Lowell. Symptoms that radiate along the Lowell connecting channel. Okay. So if they follow, like the example I used with the Dagger veins, they follow down onto the thumb, then that's considered Lowell vessel. And then numbness or heat or tingling superficially, that also is Lowell.